we wanted to spend the rest of our time with you is just to hopefully have a conversation and get your thoughts on how you might see just feedback on what we've shared with you today, as well as a chance to sort of hear, if there's anything that comes to mind that says, well, that sounds, I can see how, your partners here have done that, but here's what I would have as a challenge. So just wanted to open up for thoughts and questions, feedback, anything that you sort of said, I wish I didn't hear anything about this, and where is X, Y, or Z?
I have a question.
Sure.
When you talk about the communities, how do you go in and evaluate when a community is ready? Like, when have they put all the pieces together and identify that?
Sure. It's sort of an organic process. We sometimes start by just, we know that they're at least ready to consider the process when they invite us in to kind of hear about what is read-on and what's it take to become a read-on community. And we usually ask them to then basically pull a meeting like this together and invite a number of their different organizations that would be part of something like that, and then we talk with them about it. And then we have actually developed a toolkit that how to become a read-on community that outlines sort of the process, and it also helps them to understand, wow, if we can't even get our partners together, we're not quite ready for this. But if we can, then it's about what would that look like once you are a community? What do you do? So we've actually created some a great user's guide. So it's sort of, I say it's the once you're a read-on community, now what? And it goes through and walks them through the process of what we want them to do as far as a literacy scan. We actually have great surveys that they can just give their partners to identify what programs and services are happening in a community. So a lot of the things that if they had to do it by themselves would be a little daunting and might cause this could fall apart at any moment. We've put into place so that it makes something they sort of like we're holding their hand through the process. And when they have challenges, that's the technical assistance that we then offer up. And so we'll say, okay, so it looks like you have a good literacy scan, but what you are missing maybe is a look at really some of the data and the important early indicators in your community. And actually now we can help provide that for you because of this data task force that we have. And then it's the sitting down and going, now what's the next step? Where are your partners comfortable at? And the strategic planning of developing their literacy action plan is usually where the rubber hits the road. Because, it's hard, this collaboration, it all sounds good until you have to sort of let go of what your individual organization's goals and priorities are and kind of go for the bigger, broader vision. So we actually have sort of, again, some tools they get when they become a community, a toolkit that has a number of these things and actually helps them with assessing where they're at, what they like, what steps they need to do, and then kind of a self-check-in to, okay, I've done that part and I'm pretty good, but I need to shore up the collaboration. I need more partners that I don't have the cross-sector. So we've kind of tried to make it as easy as possible, but also because if they don't do this themselves, it's not, we can't helicopter in and do it for them. They'll own it, and now the proud parent that I can be about these read-on communities is they feel very committed to the priorities that they have gone through a very difficult process to come up with and get their partners to agree on. So they're very protective of it and very committed to seeing it sustained. And that's when we start to then they have the sort of all the things in place. Does that answer your question?
Thank you.
I think it would be helpful to know too, Laura, that the first 4 communities were funded by Helios, received support from Helios, but from that moment on, those communities have received no money to come together. And it actually means that they come with commitment to developing their own state plans rather than resources to believe that that it's about the money. And don't get me wrong, it's not that they don't need resources, and resources can follow once they identify the need, but the coming together part is not funded. So the rest of those communities that we're talking about, they have all decided that this is worth their time and energy to come together and really identify the needs in their own communities.
And a lot of them describe that that process helps knit them together in a way that, you know, it wasn't happening before. They were sort of siloed work, and that the read-on process has kind of knitted it together for them. So that's, again, I think why we're seeing such traction in them really embracing, with no thought of actual funding coming, they're leveraging their own resources, but then eventually that they have a strong enough case statement to say, we've taken the time, this is what our community needs, these are the gaps, this is what we need to focus on, and we're all ready to roll up our sleeves and do the work. And that's a pretty powerful place for them to be. So,
Yeah. Terry, I think the continuum has been so valuable for those of us who aren't experts in this, that we can really focus on it and explain it to someone else and show them this picture. But I'd really be interested in the experts in the rooms talking about how you talk about a system to lay people and people who want the very best for kids, but are clueless what system really means. And it just sounds so esoteric, and their eyes glaze over, and you've lost them. So I'm looking for some help there.
you want to take, I don't want to hog the
Sure. I will. I'll go ahead.
you can start, and we can.
We'll give this a try. My board glazes over with the word system. It was a battle to even get something funded that looked like we were going to talk about a system. What really began to resonate was we wanted a certain outcome. We wanted a certain end goal. And in order to achieve that end goal, we recognized that research and best practice identified that certain programs and services needed to be accessible and of such quality to create impact for that goal to be achievable. And then in order to do that, it made sense that you didn't start in the middle of third grade and say, oh, these children can't read, let's remediate everyone. It was backing it up down the pipeline to identify those processes that would achieve that end goal. And so the system began to unpack, and we don't really talk about it in the way of a system anymore. We talk about it in a way of having access to aligned services and programs to create the outcome we're looking to achieve. And in so doing that, they really have identified those pieces of a system, but we've tried to remove that from our conversation. It was a battle.
That's a great suggestion.
It was an absolute battle, and they totally glazed over. I get a lot of comments, where are the fun little stories about children and families? Why are you talking about you hired a facilitator to do what, you know? So it still is this ongoing process of we have to constantly remind them those programs are embedded in that conversation, but you're not going to get where you want to go unless they can align to something next in that child's development. So that's kind of where we've gone.
Great, thank you.
That is very helpful. On the other side of the coin, we've been meeting with potential grantees who are not plugged into the system, who aren't aligned and need the training, they need the professional development. How do we work with those organizations? What do we say? How do we direct them to make sure they're getting plugged in, if you will, to this system?
Well, as far I mean, certainly again, it's sort of as Marilee suggested, and you know, for as far as early language and literacy goes, you know, the easy way to do it is how are you funding? Do you know about Read on Arizona? Do you know about the continuum of effective literacy practices? If you don't, how can we guide you to learn more? And then, you know, we can help in that conversation because it really starts there with awareness, and then it's understanding their capacity of what they might not be ready for professional development yet. You know, it really does take some assessment, and that I think was the missing piece. I kind of sort of say is we had great intentions, but we were launching into kind of high literacy activities, but they weren't effective literacy activities. So we had a lot of running around, and we were wearing ourselves out, but we looked at the outcomes and they weren't really changing that much. And so now we're getting intentional about not just what we say, but what we do. And that I think is the first place to start. So, and then for systems work, again, it's defining what your system, we define and help to guide on the early literacy system, what we're trying to build, and what's that model, and then that actually is just a piece and a pillar of the whole child, the early childhood system in general. And then there are different partners that will take health, for example, family support, things like that. But so depending on sort of what their wheelhouse is, which system they should plug into, does matter. I don't know if that's helpful, but that's the way we look at it. And so
Yeah, because a lot of them may not be at a point in their own organizational development to participate in that kind of, at that level.
Right.
And so how do we, just knowing where to refer them, and have you thought about this, and no, we haven't, so then, okay, what do we do then?
Yeah, so we would love your help in, really being able to get intentional. And like I said, the more some of our partners have just, linked to the continuum and had it become part of something that they just, encourage their grantees or their partners to connect with and make sure that they can articulate what is the piece that they're doing, and does it have all the key components. And if it doesn't, then there's an opportunity to grow. If it does, great, then how do they build on that? Do they have that in professional development? Do they have that in, and so that is one thing that we hope, if nothing else, that there are ways that each and every one of you in the room can help us to figure out how you can share that. But we're also hoping that there might be more intentional conversations about what does that look like, to do that in a sector that we know we need healthy readers. Healthy readers are important. There's so many things, so how can we help connect the dots there? And how can we have your help in guiding them in that direction?
So just to follow up, thank you, Terry, just to follow up on Terry's. So if we're an entity that does not fund education, but we know we can figure this out, and we're talking to one of our potential grantees, and we ask them these questions, we really can just say, you need to call Terry. You need to go contact
really
her, and so we can be sending them to you. I just want to make sure.
You really can.
I do it all the time.
All right.
That's my phone. And what
Can you tell me specifically some organizations that maybe you guys have funded outside of, the generic stuff you've been saying that has tied them in? I saw Southwest Human Development, but that laundry list was kind of fast.
And I'll give you one that's like not even health related. So Terry's looking at a proposal from, help me with their name. No, the health screenings, the health screenings.
The fair.
ACT, ACT.
Yeah.
Arizona Coalition for Tomorrow. You guys know that they're an organization that helps provide screenings for kids who don't have a medical home, and especially in needing to do the screenings before they enter a Head Start program that has a very short time window for that to occur. Well, even looking at those health screenings, and all that we're doing is, so what are those screenings looking for from a vision point of view? Is there an opportunity? So every grant that we look at, and don't get me wrong, we're just starting to think about how that we would say is then what's the opportunity for parent education at that moment in time about reading to your child. So parents are bringing their kid there. Here's a perfect opportunity that they could then be linking to that as well. So how do we just start to connect the dots is what I'm saying to any grant request that comes our way, is not only what is the practice that you're doing, is your practice most effective? And it gets kind of easy, I tell you that, with having Terry and having these partners that you saw before, usually at least people that we're funding, Cheryl, most of them are partners already, and so they're already locked into all of the tools and resources. And it's mind-blowing to think, and you have partners here who will help me if I'm wrong, that it's not even for teachers are learning something new that they didn't have before. Read on Arizona, and our early childhood providers who were doing literacy work now have something they didn't have before. So these tools are really highly effective. So I know I took a detour, but those are highly effective. But just having those questions that we're asking to any grant that's coming, if it's oral health or health clinics or family Aaliyah was talking about if they're doing home visitation, what's the opportunity anytime that you're linking resources to families with children that we're thinking about supports that would also help with the language development at that moment in time. So it doesn't even have to be directly related. But I tell you these tools, thank you for that question.
Well, not yet. Be specific. Who are my funders that I know now that I can push there?
But is it hard when, sorry, so then there's someone who's kind of looking at the health of a child, but they're not versed in literacy. So then, are you providing education so that they know what they're looking at? You know what I mean? Like, how do they know that they're looking at a child at X level, or, and then are they funneling resources to them? Because then they do this assessment on site, and they're like, well, you're at a kindergarten and you should be at this, or how do they even know what, you know what I mean? Like, how is that person getting educated to identify where that child is?
So a lot of the organizations or partners we work with, we have actually looked at what their process looks like, and sort of, you know, where we could help to identify how they connect to the continuum. The other thing is the continuum of effective practices really has been something that we say can apply to someone with no education. You know, they're in a different sector, but you can take, you know, and understand those components. So we've actually, and we'll be having on our website a webinar that will actually sort of highlight and be a really overview training for around that, so that you can start to do it yourself, and as far as a sort of a baseline assessment and that. And then as you know, as sort of Karen and some of the others here will attest, you know, our partners haven't always gotten it right the first time, and we then work with them to sort of say, but here's, you know, what evidence-based practices look like, and here's what fidelity to implementation looks like. So when you do an evidence-based program, but you tweak something, you've now actually possibly caused yourself to not get to the outcome that you want to get to. So here's why this is important, that systems approach is important. So, so we will be having some trainings on the continuum that will be geared towards not just funders, but practitioners, but also, you know, someone, a parent or a community member who just needs to understand sort of like, what does quality look like, and I don't have a master's in education, so how do I make sense of it all? So that's really why we started with kind of, here's the sandbox, and here's all the key components. Now we need to make it user-friendly, I guess is, you know.
So when they've done that assessment, the child is, you know, seen as needing some additional support, and then there's something for the
So
practitioners.
the referral piece becomes important then, and a quality referral kind of network, and that's why the collaboration becomes really important, because you have to get to a place where, hey, I'm a nonprofit in the community, that's not my specialty, but I am part of this Read-On community, so I know that I should refer you to X, Y, or Z. And that's what we're starting to see happen, so that they're not feeling like they have to be all things to all kids. They just have to do their thing really well, and then be comfortable and committed to the collaboration of referring to the right organization once you know where that child was assessed at. And that's really why we put so much faith in or emphasis on the collaboration, because you have to be able to have a strong referral network. That has to be good. Yeah, thank you.
First of all, I appreciate all the references to oral health. Did not go over my head, everybody. Thank you.
You didn't bring us any toothbrushes, though.
I did not bring my toothbrushes today. I'll bring floss next time, I promise. But if we're interested in a particular community that is a Read-On community, my thought with my organization is there's a couple different geographies where we would like to have a greater level of investment.
Great.
And I think if we start with you, can we then have that conversation, even if it's just the two of us to start,
Yep.
to move forward with that?
Yeah, and what you know, again, sometimes it has been, someone said, well, we really focus in on, and so here's, you know, we notice you have 2 or 3 communities in certain, and then I can sort of give you sort of the, you know, background on, and who's all involved, and then if it makes sense, connect you to sort of, there's an equivalent of need for that community, right? There's a community lead that is doing, Read on Phoenix or Read on Bullhead City.
So that's how it's organized. There's
That's
a
how-
lead in each
There's a-
community, Read on
Sometimes
Community?
there's co-leads.
Or co-leads?
Depends
Okay.
on the communities and who sort of organically, but yeah, so there's a contact that I can introduce you to and make sure that you, that sort of, is much more the local, on the ground person. And that's really worked well. So they're coming to you should also know every quarter we have read on meetings, so they come and they sort of work with each other, they talk and learn from each other, they're hearing about updates, they're getting sort of more information about what else is coming down the pipeline and things. So there is, so it really is a very active, connected network that we've built in that way. So we would love to talk about specific communities because they probably have it on their priority and need help from partners that can come in and say, well, we could help you with this piece. Yeah, so you're back there, Marissa, someone beat you to the punch.
I'll be next.
I'm really new to this, so I'm wondering, across the communities, the read-on communities that you have in Arizona, who are sort of the general types of players that you have becoming members of the community? And then is there, across, like statewide, are there any players that you're hoping to bring in that you haven't quite gotten yet?
Oh, great question. My read-on communities look different depending on the community, but they're sort of, as I said, when they apply to become a read-on community, they're sort of must-have partners that have to be there. I think one of my favorite examples is Read on Globe Miami. They have 51 partners on their collaborators. So small town did not mean small collaboration for them. They pretty much took it to so they have businesses as part of their collaboration, their local newspapers, they have their childcare and Head Starts, they have their school districts, and they are very committed to that cross-sector. So they have a lot of health partners and things. So it varies depending on the community and depending on how how far they want to take the collaboration. And I think in each community there are different sectors or partners that they have either had a trouble getting to the table or they don't quite see yet how they plug in. So there's always in each local community sort of players they would like to get to the table if they haven't. And I'm thinking at the state level that would probably be the case too. We're always doing outreach to a lot of different sectors to sort of see how we make this make sense for them.
Yeah, I guess if I could
Yeah.
just really quickly, who are the must-haves generally?
The must-haves are your local leadership, if you're a town or a city, it's a city council member or the mayor, the library, the school district, child care sites, Head Starts. Am I missing? Those are sort of our must-haves, and then there's others that we encourage, but we want to see the partners represent the pipeline of 0 to 8. So that's and not just in one setting. So we want to see that whole sort of multiple settings. So sometimes after Boys and Girls Clubs are pretty much in almost every read-on community. If they're active, they're there, and things like that. But some communities don't have them, so we don't require. We're not going to make you build a library to be part of it. But most of them, and so and then the leads vary too. Leads sometimes are a school district or a county office of education, a library. First Things First has a couple of communities where they've been an active co-lead and things, as well as some communities is the local United Way. Yeah.
You showed in the beginning the data that suggests there's been improvement in certain areas, and I'm wondering if you're also thinking of tracking the read-on communities and be able to say, for those of you who are thinking about it, here's the difference that's showing up in our communities that are actually actively engaged. That may be more of an incentive to bring more on board.
Yeah, no, absolutely. Thanks. That's a great question too. So absolutely, and for those that have been going for a couple of years, they are doing that, and then we are actually building in for our newer communities a way that they can track their priorities and then what are the activities that they're doing that have an impact in that, so they can tell that story. but, you know, over time, so.
Yeah, it's still too early, but.
It's a little early yet, but we put it in place, so, so we have this data integration task force that has helped us to identify, and collect data on 25 different areas of early literacy, from family engagement, health, education, and early childhood, and that will allow our communities to say, where's our baseline? And then based on what strategies we did we move the needle?
And that's the power, so these partners are incredibly awesome, and I don't know, is there any other model where we're taking state data from so many sources and putting it into one filter, if you will, to look at the outcomes related to this?
I mean, is any other states?
It's pretty significant, so their data, not only, wait till you see what Terry's got in store, because it's not just the collection of all this data that's centralized from these
It's
multiple
read-on, by
parts.
the way. It's
It's
not me.
read-on.
You're
Well,
making me
read-on.
sound like
Well, we all do whatever she asks us to do. But the partners have put this data together, and then now it's mapped. So literally, communities are going to be able to go online and look deep to know where are their gaps and where do they need to concentrate their attention. Because as you guys know, what'll happen is, I'm a program, I'm looking for grant funding, and I'm serving this community over here. But is that community over there the community that needs it most? Or does that community, and now you've also got to be paying attention to, you've got some other areas or pockets that are not getting their needs met. And as funders, we're sort of in the blind. We're just whatever they're coming to us for, to ask for support, and we don't have any tools that help us figure out, is that where we should be investing? Or is there an opportunity to encourage investments that are in other communities that we care about? So she's got some pretty impressive tools that are still yet to be rolled out.
Coming soon down the pike, but I think partly was we recognized that we needed to set our communities up for success. And so how can we really ask them to make strong early literacy action plans if they didn't have the information and data that told them where, you know, sort of to focus. So we've spent a good 18 months working on this with the multiple help of every partner you see sitting here and many partners that were on that list. But the whole idea is that we want to drive decision making based on data, and that if they had to go to 8 different places to find it out, and some of it wasn't even available publicly, then we were making it too hard for them. And so this data center that we'll have for read-on communities will be, like I said, around about 25 different sources of data that will say, this is, if you're not looking at all of this, then you probably are not looking with the whole lens that you need to be looking at, and you're not going to see, you know, you might think you have a 3rd grade reading problem, but you have actually a health issue in the early 0 to 5 pipeline that you need to address. And that's always going to be a challenge, and you're always going to struggle here if you don't address this screening issue here, things like that. So that's the exciting, and again, I just look at it as opportunities, and setting our communities and our partners up for success by really trying to be intentional about not just what we say, but what we do. But again, we're standing up here and making it all sound really easy, and it all just happens, and you know, the blood, sweat, and tears of every partner you see here today with me and many others that couldn't be here with us today are what we're learning from, and it helps us make it, you know, that much better. So I'm saying the read-on communities that come on now are benefiting greatly from those that sort of think, we built this. Yeah.
It sounds, I agree with you that collaboration is messy and complicated and difficult and well worth it. It sounded like you're providing technical assistance for the read-on communities. Is it around collaboration and the essentials collaboration, how to be successful, that kind of capacity building assistance?
Yeah, that's a great question. Some of it has, you know, I always say sometimes they think they are being collaborative, and we're showing, so we have some documents and tools, metrics of collaboration. So how do you know, maybe grade yourself, give yourself a little assessment on, do you have all of these things in place? Because that might tell you that actually what you think is a strong collaboration isn't quite there yet. So that's been really helpful. So it's in the expertise in sort of the continuum, but also in how do you know, suggested ways to strengthen your collaboration and really understand your partner's needs and why it's how to sustain them, you know, their effort in the long run, has been something that we've been working on too, and we provide. And I'm happy to say that a lot of them have really taken the user's guide and the toolkit that we put into place that has a lot of those things, and taken it to heart. And so, they aren't making some of the missteps that you might have seen, naturally, because they kind of have a roadmap. We try not to tell anybody they have to do it. We just give them and really encourage and word, hey, we used that and it's really helpful. And so suddenly they're like, we have that? Oh, we do. Let's use it. So, yeah.
I think many of the organizations that were represented today are part of the Thriving Together piece as well. They have to sit at the table. How are you integrated into that piece of it, or are you aware of it? I don't know how the
Sure.
interaction works.
Sure. Well, yes. So, if they've identified third grade reading as part of, and Thriving Together is targeted in one high school district with feeder schools that are all part of Read On. So that's how it's connected. But we really encourage any of our partners that are doing collaborative impact and using different frames. There's no reason it doesn't connect, and there's no reason that you aren't benefiting from the work that Read On. That should be your sort of third grade plug-in model, right? And then you build on that. So a lot of the same partners are all working in that effort, so they can hopefully navigate and facilitate that. I mean, that's what I'm seeing, and we're just encouraging again that to happen. There's no
Because on those
reason for
breakouts, I'm on that collaborative action team that's
Oh,
for
okay.
third grade reading, and I don't think they've referenced, to my
I
knowledge.
think you
they-
missed a, yeah, I
I
think
may
you
have.
missed a meeting where I came and presented.
There you go.
And we've
I know.
encouraged and given them all the tools, and I can
Okay,
always,
good.
that's helpful for me to know, because I can encourage them to say, hey, don't just count on the people that come to your meetings, but send it out in a broader, but we actually came and presented on the continuum and offered up again for the 0 to 8, we're here as a resource, and that they should see Read On as a partner. In fact, there's a few follow-ups that came out of that meeting that we're providing a look at some of the schools and areas that Thriving Together is identified as they want to work in. So those are the kinds of things that we can do once we kind of know where it's headed. So we just came, we presented, we offered up help.
It's a really important question, because I would tell you, it is the one thing that the partners who have joined in, and I hope every single person in this room will consider being part of the Read On work, because it's what happens to us when we're all pulled off on different, right? New initiative, new focus, new area, new name, new intention, and that's what keeps us from ever making gains, right? And I'm not suggesting that that's the intention, because that's a cradle to career focused initiative. But for us who are putting this stake in the ground to, we're going to do literacy right, and we're going to be very intentional about how we're doing this work, and not take us off course. So as funders, the best thing that we can be doing is saying, whatever somebody's coming in to do, well, how does this align to that work? So that it isn't, you've got to be part of this work. You can't go off and create another separate parallel play kind of thing that takes the resources away from really doing this. So as funders, just asking that question wherever we are, because that's what happens, right? A national agenda, a national initiative comes into states, and now we're reorganizing ourselves, and sometimes that really takes us away from the focused work that we have. So we're really trying to hold tight to, this is the model. If you want to receive funding from public or private sources around this work, this is the model. You cannot, you can put it in, like Terry said, it's completely aligned, but you can't take it off into a new direction. There's just too much, all the tools and resources have gone directed this way. So
Why would, just to sort of, why wouldn't you? So we've just tried to sort of say, what help can we be, and how can we help with what you're, and so it's great for you to sort of, because I just come to one meeting and decided to do this, but I don't think about, hey, we could ask them to make sure that they're messaging and connecting the dots a little bit more intentionally. So that's really helpful feedback. Thanks.
Okay, I know 1:30 was the closing. These are great questions. And first,
Yeah.
Terry, I've got to say, it's been about probably 18 months, whenever you came here the first time, and I think we've captured
Just
on
getting
video
started,
somewhere.
yeah.
Yeah, but the progress since the last time we were here is very impressive, so I feel excited that we're actually moving forward on something really important. Couple of reminders, one, we did videotape the program, and we will post it at our YouTube channel, and so there's an opportunity for plenty of other funders who weren't in the room today to hear more about this, so I think that's an important way to continue to share this message. You've got your little blue evaluation sheet, so please fill those out and leave your tags on the table. And I guess we're busy. We've got one more program this week on Thursday, which is about civic engagement. That's another lunch engagement with a group of national funders who are putting money into Arizona around civic engagement. So if you haven't signed up, there's probably still space for you. And I think that's all I'm going to say about upcoming programs. So you guys have a great rest of the day, and we'll see you soon. Thank you so much.